Farm Fun. So what drug group controls the inflammatory response in the airway, usually associated with COPD and asthma? Good job. Steroids or corticosteroids. And this medication restores normal lung compliance in neonates with respiratory distress syndrome. Good, and that's Survanta. What kind of drug is Survanta?
It's surfactant.
Unmuted.
It's a surface active agent, right? The exogenous surfactant. So Survanta, Boactant, Exosurf, any of those. Oh, AJ's taking a lead. Upon assessing a patient you recently extubated, you hear stridor. What medication should you ask the physician to order? Good, Nephron. What is Nephron?
Racemic epinephrine.
Yep, racemic epinephrine. What's another name for Nephron?
Racket.
Racemic epinephrine. What are the other brand names for Nephron?
Nasoepinephrine.
What did you say? I'm sorry.
Sorry, basoepinephrine.
Epinephrine?
Is it?
All right, is that what you're saying? BASO?
Yes. Yes, ma'am.
No.
Is it asthmaepinephrine?
Asthmaepinephrine.
Microepinephrine.
Microepinephrine.
And asthmaepinephrine.
Yep, and asthmaepinephrine. I think we hit them all. Okay, so let's take it over. What two medications combine to make Advair? That would be Flovent and Ceravent. What's the generic for Flovent?
Is that for Motorol?
No. Fluticasone. And the generic for Ceravent?
Oh my gosh, what's that? Is it Salmeterol?
Salmeterol. Yep,
Okay.
good. Let's take a lead. What two medications combine to make Symbicort? Good. Pulmicort and Formoterol. What's the generic for Pulmicort?
Albuterol?
Budesonide.
Budesonide.
Oh, that's right.
Pulmicort is budesonide. What kind of drug is it?
Steroid?
Yep, steroid. Good. And for Motorol, generic is
Word.
That.
Wordle.
That's right.
for Motorol. That is your generic. What's the brand name for it?
Moradil?
Oradil. There you go. So your generic for Motorol is for Motorol. So sometimes you'll have the two generics. Sometimes you'll have two brands. Sometimes I can give you either one. Because again, you got to know which one is, you got to know both of them basically. And what kind of drug is for Motorol or Oradil?
Adrenergic.
Is it a long acting, short acting?
It's short acting.
Long acting.
Long acting. It's a LABA. It's a long acting beta agonist. Okay. Remember, we don't combine steroids and short acting ones together in the same drug because then your adrenergic is going to wear off, but your steroid is going to last for the rest of that 12 hours or for the rest of the day. All right, Alfie's coming on up. What two medications combine to make Dulera? Okay, and that's mometasone, aka
Asmanex.
Asmanex, good, which is a steroid. And then again for Motorol, which is our LABA, aka Oradil. Good. Oh, and let me take it away. Ipratropium bromide and albuterol combine to make good, Duneb or Combivent. When does it become Combivent?
When it's an MDI.
When it's an MDI or the Respimat, and of course it's Duneb and the small volume neb. What's the brand name for ipratropium bromide?
I don't remember.
No.
Prevenal.
What? Say what now?
Prevenal.
For ipratropium bromide?
No, that's albuterol.
That's true. So Atrovent.
Atrovent? Okay.
Yep, it is Atrovent.
Oh, I wasn't sure. I said it, but I wasn't sure.
What kind of drug is that?
It's a short-acting adrenergic.
No.
A steroid?
Nope.
Nope.
Is it Xanthi?
Anticholinergic.
Yeah.
Anticholinergic. It's an anticholinergic. Short acting one doesn't last all day, but it is an anticholinergic. What's another name for an anticholinergic?
Parasympatholytic.
Good. Yep. Parasympatholytic. Good job. And of course, albuterol, Pro Air, Proventil, Ventolin, and it's an adrenergic. What's the brand name for metoprolol?
Halutant. I did hello.
We're gonna give you we're gonna erase the day for you. All right. So parasympatholytics are often used in conjunction with sympathomimetics to enhance bronchodilation. This is an example of Good. That would be Duaneb. So like we said before, that would be your ipratropium bromide and albuterol mixed together. Okay, what would be added to 0.5 mLs of albuterol for a small volume neb treatment? Good. Isotonic or normal saline. Remember, that can be used as a diluent, and we can use it to add to our medications. Hypotonic saline, we rarely use it, but it's just saying that it's less salty. So that's usually nurses give it for injection. And you could use sterile water as a diluent for some drugs, but for albuterol specifically, we would use saline. So sterile water you can use for like a lot of times your powdered drugs, so like casein, pentamidine, things like that. Okay, blank is a very strong beta-2 receptor. Stimulator is what it is. Okay, and that is blue isoproterenol. So isoproterenol is a very strong, again, looking back at your sheet with your strong, very strong, minimal, etc. Isoproterenol has very strong beta-2 receptors, which means what's it going to do to your patient?
It's going to cause bronchodilation.
Yep. So a lot of bronchodilation. Good. If it were a beta-1 receptor, what would it do? Or beta-1 receptor stimulator?
It would cause increased heart rate.
Increased heart rate and contractility. And then if it were an alpha receptor stimulator, what would it do then?
Increasing blood pressure.
Yep, increased blood pressure. Be vasoconstrictor or vasopressor. Good job. Okay, let's keep in her lead. Amanda's on the trails. Virazole must be administered using a SPAG. What does SPAG stand for?
Small particle aerosol generator.
Yeah, good. And what is Virazole used for?
The PCP pneumonia.
Near?
Babies with RSV.
Yep, RSV. What's the other name for Virazole?
Ribavirin.
Good. Your patient has pink frothy secretions. What drug would you or should you administer? Good. That would be ethanol or ethyl alcohol, the liquor. Put it in the nebulizer to decrease the surface tension of those frothy secretions. Which correctly describes the duration, of adrenergic receptor effects of epinephrine. Sorry. So which describes the duration, which describes the receptor effects. And so it's all of them because the duration is 1 to 3 hours. For epinephrine, it's a strong alpha, so it's going to help with low blood pressure. It's going to help increase the rate and contractility of the heart, and also has some bronchodilator effects. So all of these would be true. Elevated levels of cyclic 3,5-AMP result in
It won't let me answer.
Did you say wrong answer?
No, it won't let me answer.
Oh, it won't let you answer. Oh, okay.
Ugh.
Well, that's bronchodilation. So what's the process that leads to those increased levels of cyclic 3,5-AMP? That's the pathway to bronchodilation.
The activation of adrenaline cyclase. It increases the ATP into the cycle of the 3,5-AMP.
And so that stimulates the production of the cyclic 3,5-AMP or increases the level. Yep. And that causes bronchodilation. Good. Okay, what is the max dose for a single dose of isoepinephrine? Good, 1 ml. Which is an alpha receptor stimulator. Good, vaponephrine. Oh, I think that's where you were going with that earlier, AJ, instead of vasonephrine, vaponephrine. I was like, what? So that's an alpha receptor stimulator that's going to cause an increase in the blood pressure. Which drug has the least beta-1 stimulation? So, and that, of course, is isoepinephrine. Okay, methylxanthines work by and they inhibit the phospho-D, thus maintaining those high levels of cyclic 3,5-AMP, so they continue or extend that bronchodilation. Just taking the lead. The generic name for Bronchosol is isoepinephrine. Okay, what is an advantage of administering a drug via aerosol? Yep, all of the above. Good. So your patient can administer it to themselves. Immediate onset of action as little as 5 minutes for some drugs. Reduce systemic effects, and you can give a smaller dosage. True or false? You receive an order for Flovent HFA 500/50 micrograms, 2 inhalations BID. It's long. It's a complete order. Okay, so it is complete in that it has all its parts, but you, as an amazing RT that you're going to become, are you going to know that Flovent does not come in a 500/50 microgram dosage? Okay, Flovent is one drug. It's fluticasone. So 500/50 would indicate that there are two drugs in this one medication that you're going to administer. What type of aerosol is recommended for a patient with a weak, non-productive cough who needs to provide a sputum sample? That would be hypertonic saline. Remember, that's going to be extra salty. It's going to make your patient cough and provide that sputum sample for you. What is Xolair? Very good.
Is that a type, like a brand name on Xopenex?
No, it is a brand name drug, but it's for a different drug. So that's the asthma injection, the one where the patients have the increased levels of IgE and they go in for a monthly injection.
Right, yes.
So that's Xolair. Xopenex is the brand name for levalbuterol, excuse me.
Thank you.
What is synergism? So two drugs act on the same organ. They're trying to achieve the same thing, but they work by different modes of mechanisms of action. So that would be like your Duomed. You have an adrenergic, you have an anticholinergic. They're working to achieve the same thing, bronchodilation, but the way they work is completely different. Okay, what is the mode of action of cromolyn sodium? Used for the prophylactic treatment of asthma. What kind of drug is cromolyn sodium?
Mast stabilizer.
Mast cell stabilizer. Good. Okay, so what are the results of alpha stimulation? Vasoconstriction, vasopressor is going to result in an increase in blood pressure. Generic name for Mucinex. Acetylcysteine. Nebupent is pentamidine, which is used for
PCP pneumonia.
PCP pneumonia, and you give it via a respirator. Good. True or false? Patients should always rinse and spit after taking an MDI. That is false. They should always rinse and spit after taking a corticosteroid. Not every MDI, but of course, if they have a corticosteroid via SVN or via MDI or even DPI, they should be rinsing their mouth then. Okay. Respimat is a synonym for SMI. And this SMI stands for
Small mist inhaler.
soft mist inhaler.
Soft mist inhaler.
Last one. You should stop the treatment and document the occurrence. Tell the nurse or physician and possibly suggest alternative medication if your patient's heart rate increases by 20 beats per minute, or more. So if your patient's eyes bulge, what is that an indication of?
Intracranial
ICP.
An increased ICP. So usually that doesn't happen from just giving a drug. That happens if your patient is coughing a lot, they're in a head down position, IPPP treatment, things like that. Good job, Flo. Good job, Amanda. Good job, Ashley. Adrian, just a good job as well. All right, last one, hyperinflation. Any questions regarding